Good afternoon. I'm Satish Jain, and I would like to take this opportunity and welcome you to this afternoon's forum for People for Public Services. Again, welcome. As I take this task on chairing this afternoon's meeting, I would like to thank you all for sparing your valuable time this afternoon. Thank you again. And as we very much hope that you will be able to enjoy and hopefully benefit from the detailed information which is about to be given to you from an excellent team of people who are about to come on. Next slide. Okay. This afternoon, the agenda, it's going to be myself first, then June, thereafter Graham, and then back to myself for the closing remarks of the meeting. Next slide. Okay. Let me start from who we are. As you can see from the slide, we, within the People for Public Services, are a volunteer group of Birmingham residents who have come together via Birmingham City Council to support, aid, advise and help where needed in the various projects within Birmingham City Council. Plus, we have a very diverse, multi-skilled group of people who meet on a regular basis to discuss various projects, subject matter within Birmingham City Council. I very much hope that the information which is about to be given to you and give you a small insight into our group's activities. Next slide, please. And now, without further ado, let me introduce Jane Marshall, Customer Experience Manager, who will take you through how Teams Live will work for you. June.
Thank you, Satish, and thank you very much for spending the time this afternoon. Good afternoon, everybody, and welcome to our first ever online citizen forum. We, like everybody else, have been affected by the effects of lockdown and COVID. So from March earlier this year, we've all been working from home. And as many of you will be aware that up until that point, we were all working in the office in Woodcock Street and having face-to-face meetings with you all. So this is a new one for us, a new online forum using this new technology. We are using it with our teams within the City Council currently, but this was a new one for citizens. So we do value any feedback you can give us whatsoever. So if we can just move on to the next slide. So why are we using this virtual forum? It's going to bring us together in a safe environment for obvious reasons, and many of you will know we had to cancel numerous citizen forum meetings. We do acknowledge their limitations in this format, so we're trying to seek some answers, and as I said, any feedback would be gratefully received. The team are working to try and make it more engaging and more widespread all the time. We'd like to continue to bring you up to speed with latest key issues. And here from our management team direct, I'm delighted today that we're joined by Professor Graham Betts, who's the Director of Adult Social Care. So he'll be talking you through some slides in a few minutes about what we've learned and the lessons we learned from the lockdown. Obviously, we're testing new ways of working as we don't know when we're able to meet you face to face. We don't know what the future holds for any of us. So we're just very, very keen in order for everybody to get the opportunity to join in and influence and engage with us and co-produce our services again. Can I have the next slide, please? Thank you. So how you can get involved today. So you'll see on your screen, and you'll see a little gorgeous picture there. So you'll see the slide deck. I'm hoping you're all seeing the slide deck. And what you'll also see on the bar, if you hover over your slide deck, you'll see an opportunity to raise questions, to raise Q&A. this service, this package within Microsoft Teams is slightly different to those of you who have used Microsoft Meetings. But because this time you can't join in and talk to us. However, what we really would encourage you all to do is, if you've got any comments, any feedback, if on the little control bar at the minute, in the middle of your screen, there's 2 little people, and next to that it's 2 speech bubbles with a question mark in it. If you click on that, it will open a Q&A, and there you can actually post any questions and slides, any questions you wish to raise. Somebody's just asked me already. I can answer that question straight away, Kate. So Kate, you're on the ball. Will you share the slides afterwards? Definitely. They'll be available on our website, and we'll make sure you all get a link. And what we also can do is share you a film of this if you wish to as well. So we can do that. So as you can see, it's interactive and it's a live feed. So as soon as you raise a question and put it in that Q&A, we're able to respond to it. There are slots during the presentation where you do have an opportunity to feed back to you. I would encourage as many of you as possible to make comment. And the reason I say that is it's all recorded. So any comments you now make in that box where you type it in will be incorporated in the findings. Can I have the next slide, please, Amanda? I'm going to hand you over to Graham now. As I said, Graham's our Director of Adult Social Care. Graham gave me an ask at the start of lockdown, or actually gave me an ask a couple of 2 or 3 months ago now, as lockdown had been going on. And the ask was, how do we learn some lessons from citizens about what their experiences were during lockdown? So we had over 800 online responses, and many of you may be there and you may have already responded. That doesn't prevent you from making further comment today, because all the feedback that you provide to us will be fed into management team, and if we do get another lockdown, then at least we will use that to inform how we manage services going forward. So if it's okay, I'll pass you over to Graham.
Okay, thank you very much, June. Thanks for the introduction, and also thank you, Satish. What I would say, and if we move on to the next slide, I'll begin by saying really, you know, it's been an extraordinary time, and not always in a pleasant way. It's a new experience for us all. We're all learning things that we didn't know how to do before, like this video conferencing and so on. But what we really want to do is to take today as an opportunity for you to feed back your experiences. And as June says, the reasons for that is because we want to learn from them so we can improve going forward. And June's right, I did ask her to do a kind of listening exercise, because I could tell that from the feedback I was getting about services in general, some things went really well. So for example, I've been visiting our care centres this morning and early afternoon to find out what happened in the care centres, and there's some extraordinary stories of how things went very well. But I also know there are other cases where things didn't go as well, and we need to learn from that. So that's why we asked June to undertake an exercise, a sort of survey, to try and begin to build up that feedback and knowledge, and also to try and test out new techniques so we can, as I say, improve on how we go forward. I think the thing I would stress is it was, you know, a new experience for all of us. None of us, you know, including, you know, very elderly people like my mum, have ever experienced anything like this. And, you know, it was very challenging, particularly at the beginning of the exercise. There was a lot of inconsistent advice and guidance flying about. And we really, you know, did find it very difficult to try and get on top of it all. So I don't think I would want to underestimate the challenge we faced and how we responded. I don't think we got it right all the time. I think we did get some things right, but not all the time. And we need to learn, because as June said, there is a risk that there will be a second wave or subsequent waves or local spikes. So we need to keep learning and improving, because this is clearly going to be with us for some time. So what I'm going to do is run through the slides. But I'm going to do that quickly so that you can get a chance to join in, so that when, as June said, when you see questions coming up and the responses to them, you can make comment then, you can feed in your views then, and it'll all get added into the final product. So you can see the questions up here were really around the areas of, did you see a change in your support? Did it improve? Were changes explained to you, and did you feel your care and support needs are currently being met? Those are the kind of questions we were asking. Do you want to go on to the next slide? And these are the results. Well, over 800 people responded, and of them, 230 identified themselves as receiving a service or being a carer, and it's their responses we've focused in on. Next slide. And as I said, I will run through these quickly because you will get the slides, and you'll still have an opportunity over the next few days, week to continue to feed in. So really, the first question was, how much do you agree with the following statements? You can see them there. I saw no change in the support received, and so on. Do you want to move on to the next slide? And these were the results. This is what people said. They didn't agree with this, that, or with this statement rather, that they saw no change. About a third did, but over 50%, that's over half, disagreed. They did see a change to their support. Next slide. A quarter of the people saw an improvement in the service, but 3 out of 5 said that they didn't see an improvement in service. So obviously, from our perspective, that's disappointing, but as I say, not entirely surprising given the very challenging circumstances we were dealing with. Next slide. A key issue for us was really, we recognised that things were changing and moving at a very fast pace, but what I'd really hoped was that they would be explained. But as you can see, about half of people said changes weren't explained, whereas about a third were. So obviously, we'd rather it'd been the other way about. We'd rather everybody said, yeah, everything was explained to us. Clearly it wasn't. So there's a real important learning point for us in our thinking about that. Next slide. And in terms of current support needs, again, a similar proportion, a bit better than the previous slide, but still, a concern that about half of people are saying their current care and support needs aren't being met. Next slide. And what's interesting is people are saying that their current care and support needs have changed, and that's in response to the current situation that we find ourselves in. So again, we need to be finding out why that is, and then look to respond to it. Next slide. So this is the opportunity really just to pause and get some feedback, which June, will you be helping with this?
I will.
Yeah. So just, and then as I say, June will judge when to move on to the next set of slides. That was the first group in terms of what people felt about those experiences during the COVID period. June?
So we've had a couple of questions already received, Graham, and if anybody in the meeting would like to add more, please do so using that Q&A button. So the first one was from Lisa. So with all of the changes being made with care plans, do they need to be rewritten?
Okay. Do you want me to take these one at a time, June?
Yeah, we're okay to take these one at a time for now, please.
Okay. That's a good point. I mean, in terms of care plans needing rewritten, that I think is what we will need to identify. Now, in some cases, it may mean a tweak to services, or where things are just a bit different, moved, not a big difference. But for others, I have heard, of cases where people were, did actually have coronavirus, and it's had quite a profound impact on their level of disability. So that would need a real revision of the care plan. For less serious cases, it may be we can adjust it through a conversation with the provider and the social worker, just taking a judgment about maybe it needs a bit more input, maybe it needs to be developed a bit more. But clearly, people may not be aware of this, we have 15,000 live cases in adult social care. It's a huge volume, and if you were thinking that half of those were needing to be revisited, getting through 7,500 cases, it will take a lot of time because we've got new cases coming in all the time. So I think what we'll be doing is prioritising reviews, excuse me, reviews of cases and so on. And where possible, if it's just a tweak, a small change, those are things that can be done quickly over the phone and so on, that's fine. Other cases we may have to go out and do, as I say, a reassessment. And certainly that's the case not just for social workers but for occupational therapists as well. We've been I've seen cases coming across my desk and I've been asking for the OTs to go back out and take another look. Okay.
Great. So the next question is actually from Michelle Birch from West Midlands Police. Hello, Michelle. So we had great difficulty in obtaining and sharing details of vulnerable adults living within our communities who were suffering without the required food or basic provisions. How will we share this information quicker going forward if we need to?
Yeah, thanks, Michelle. The reality was that we were sent the initial list of vulnerable people that were to be shielded and so on. We got that, I think it was at midnight on a Friday night. It came to me and I had to get it out to people to begin to action. We then had to, over the weekend, begin to get the food moving out to people and so on and so forth. I mean, it was not a great exercise. The government were doing its best, so this is not an exercise about blame. Everybody genuinely was trying their best. But those lists, the initial one came through and I think it had about 1,500 names on it. Over the next few days, we got 2 more lists and each of those had 5,000 names on the list. All of those names had to be checked because, for obvious reasons, duplication, people that didn't need food or any support at all. It all had to be checked. So it was an incredibly challenging logistics exercise to go through the list, verify the names, check that people needed support, and then get the support out. What we did do, we established a helpline as well, an emergency line, to provide a kind of safety net in case people, for obvious reasons, were slipping through it. But the list that came through, the quality of them was not great, is the absolute truth of it. And I would hope that if we were put in a similar position next time, our colleagues who produced the lists in the NHS would be able to send through more accurate data which we could act on straight away rather than them to check it all first and then go out and begin to coordinate the food. The other difficulty we had was that the government had arranged with some major food providers to get food out. It worked in many areas. In Birmingham, it didn't work at all well. And at first, we only had about 100 people getting food direct through the government supply. And the people were basically getting their food from the city council. Now, again, what we would hope is that we can learn from this, because this is what the exercise is about, so that, as I say, we get better quality information in the first place and the logistics behind it run more smoothly. But I mean, I would say it was all credit to the city council and its staff and partners and volunteers who made sure that as far as possible, no one went without during that initial phase. Thank you.
So we've got a number of questions in, Graham. So if I just do another couple and then we'll perhaps move on, because we can always, what we will do, everybody, is just, we will publish these and give you a Q&A document afterwards, so your calls will get, your questions will get answered. So the length of care calls were reduced, but as the client, it was not communicated to me and I still had to pay for my agreed hours. And that was from Stephanie.
Yeah. I mean, some of these decisions were having to be made, in a very ad hoc way, as people I'm sure can appreciate, because of the pressure on services. At the initial phase, we were losing staff to COVID-19 or similar symptoms, so people had to withdraw services. So services initially did come under a lot of pressure. So, I mean, clearly, if that is the case, that needs to be picked back up with the social worker so we can revisit that. And make sure things are tidied up and we don't get back into that position going forward. And again, I mean, it's not trying to make excuses. It was just the reality of the situation. At some points in some teams we had 20% of staff off ill, so it was very difficult to maintain services. But certainly, we're in a position now where hopefully we can get back to people, sort those things out, and move forward in a constructive way.
And I think it's along a similar theme, if I'm not sure, Graham. So this one was from Andy. So he said, for me, the issue is that I heard nothing whatsoever from social services, who had placed my mother in a care home before lockdown. She has been to A&E on her own twice, and I have had to deal with selling her house on my own. While I accept the pandemic is very difficult to cope with for everyone, will there be any improvement in communication if the lockdown resumes?
Yeah, I think communication is a big issue. We'll see this later on in the slides. I think it will come through as a theme, really. And the theme is, for some people, they were communicated with very well, and they really appreciated that, and that was a real success. For others, they felt cut off and alone, and that's what we need to address going forward. So I think that, for me, one of the major themes to come through from this is the lack of communication in some cases. In other cases it went well, as I say, but we need to be much more consistent in the future about the communication, because it did make all the difference. The feedback we had, if people were communicated with, even if it was just to ask them how they were, they felt a whole lot better about that. So for me, that's one of the big themes we really need to address, and we need to improve upon going forward.
I have other questions in, but would you like to move on through the rest of the slides and then we can come back to them if necessary?
Yeah, I mean, as I say, we've got, if we get through the slides, that gives people a sense of the question areas, and then we can pick up some of these other questions. Yeah, okay. So here we go. In terms of communications, this is about contacting the City Council. Were you aware of the changes that the City Council was having to make, and were you able to find information regarding changes to council services? So let's look at these. Those are the broad questions, so if people want to write in a question, but we'll look at some of the findings now. So if we go on to the next slide. Okay, so again, we go on to the next slide. We'll begin to get some of the results. Thanks, Amanda. Okay. So in terms of this, you can see it's a fairly even split between agree and disagree about being able to contact the City Council. With half of people saying neither. So can we go to the next slide? The good news is that about half of the people were fully aware, but again, it's about a third were disagreeing, saying they weren't fully aware. So I think some of the City Council will want to look at is how well it was able to communicate what was going on from the City Council. Again, similar. I mean, it's encouraging, the fact that it was over half, but it still means there was a quarter of people weren't able to find the information. So we need to improve. We should be trying to get to 100%. So this is the opportunity for you to raise points or questions about communication, and I'd be interested as well in people's ideas about how we could improve. I mean, as you know, Birmingham, it's a very big city. It's very, exercises, like writing to everybody, it's like, well, that's an awful lot of households to write to, for example, and make sure you get out and so on. Is that what people would have wanted, or should we have been, was there more we could have done on the radio or through the internet? So I'd be very interested in people's thoughts about how we could improve, because I mean, as I said, we're not experts and we've never faced anything like this before. So we need to learn from your experiences. So I'd be really interested in your thoughts.
So we've got one Well, we've got a few questions in, to be honest, but we haven't got any recommendations yet about how we can improve our communication with citizens and providers. So I've got a couple of provider questions in, Graham. So as a support worker of vulnerable people, support has slowed down significantly as services we would normally address while with the service user have taken longer to process due to delays confirming permission to speak on their behalf. Many have no internet. We have not yet returned to face-to-face support, and many vulnerable people are living alone. And that's Paulette of Swanswell.
Mm-hmm.
And just another one while we're on providers. Gary, we're a provider for people with cerebral palsy. Communications with the City Council have been really difficult for us. We're having some difficulties with funding, withdrawal of some service users within our service. It's proven very difficult to speak to the responsible officer. We do have good relationships, though communications still prove highly frustrating. The City Council staff don't seem to be communicating with each other. For example, commissioners are not communicating with social workers, so the same messages are not getting through. Do you want to take those two?
Yeah. So, I mean, obviously, I'm sorry to hear that. And as part of the exercise for the management team, we will take that away and look at it and think about our internal communications as well as our communications with external providers. I mean, if I could just say, because I've got the opportunity, a big thank you to providers. I met some this earlier today who they couldn't do face-to-face services, but they've been doing everything else they can. So I think providers, like everyone else in the community, has really rallied round to do what they can in these very difficult and challenging circumstances. The issue about, when will these services begin to come back on stream, I think it will really depend on what happens as we begin to move out of lockdown and how safe we feel it is to begin to run services again. In the meantime, I think we need to be all thinking about how we can do things differently, alternatives to what we've been doing in the past. And I think we need to be trying to, communicating that to each other. So I will take that, I'll be taking all of these points away, but I think there is a particular point there about making sure that commissioners are engaging with frontline social workers about what is being commissioned, what isn't being commissioned, how it's being commissioned and all of that, so that people do understand what is available, what's possible and so on. And that does improve on going forward.
Just on to communication, Graham, we've had another couple of comments. So for some people, post is the only option. I saw a lot directing people to go online. Not everybody has the skills or technology to do so. And Andy's come forward. Thank you, Andy. I'm delighted you like this, the weekly update. So this is not a question, but an observation. I found the weekly general email from the council to be absolutely excellent. Maybe going forward, this needs more publicity.
Great, thanks for that, Andy. It's really good feedback. I'm pleased that it works for some people, and I think that's the general point. It works for you, you find it excellent, you find it really useful, fantastic, that's great. Then other people are saying, actually, I don't have that kind of technology and I rely on the post. So maybe the learning from that for us is to make sure we know how our citizens want to be communicated with. So I mean, a lot of people on this call will know when you take out a service agreement or something like that, you'll also get a bit of it which says how do you want us to communicate with you, email, text, or that sort of thing. I can't see any reason why we couldn't do that as well, June. Just thinking about adding that to so that we know that's it's all very well saying, oh, it's on the internet. Well, again, that wouldn't help my mum one job. You can put anything you want on the internet, she wouldn't see it. So how would if you begin to bring it back to your own experiences, that would be really helpful. I think if we knew that some people were on the email, did check their emails or text or whatever, so that we can make sure we get the message to them. And even if the message was to say, it is online, all of this information, and then people can access it that way. But for those that are saying, oh, everything by post, we know those are the ones we need to make sure we get the post out to. So that might be something we want to think about going forward, June, in terms of making sure that we're on top of that and know how people prefer to be communicated with.
Absolutely. We can do that, obviously, if we can make sure that we've got accurate email addresses from our users as well, Graham. So that will be helpful, because then if we haven't got an email address for a service user or a family member, then we can think about posting out the information. So absolutely. Dawn from Age Concern again. If we go into lockdown again, will closer links be made with supermarkets to ensure food can be purchased for those most in need? We spent so much time trying to organise this in March.
Yeah, no, I mean, again, this is where you're trying to avoid sounding as though you're making excuses or blaming other people. I mean, it was very difficult. We, like you, Dawn, we were trying to, make arrangements with supermarkets and so on. And in some cases, we would make arrangements to have them then unpicked by the government, who wanted to use them for their own supplies. So it was an incredibly difficult challenge, I think. The one thing I would hope that the government learned out of all of this was, actually, if it was left to people to sort out at a local level, it worked much better. So I think when local groups like Age Concern, like BVSC and so on, when they were working with local supermarkets and so on, local food suppliers, it generally worked much better than trying to do it at a national level and expecting it to work, from Whitehall down to, Erdington or whatever. It just doesn't work like that. And I think that if there was a lesson nationally, it was that actually when things were devolved, including PPE, food, shielding, all those things, and as we've seen now, we track and trace, generally things work better at a local level because there's local knowledge, local connections, local networks, so on and so forth. And if I think about some of the services that we run, some of our day centres, for example, they have absolutely brilliant links with local supermarkets, who provide, as well as food for events and things like that. They generally donate money to support them. So there are excellent links at that local level. So I think you're absolutely right. Something coordinated at a local level involving the voluntary sector, involving the supermarkets and the council, that would be the best way of organising it.
Great. We've got a few more, Graham, if you're happy to take a few more. So Kate's
I'll take one more, and then, June, you forgive me, please. I forget how many more slides I've got to do.
No, it's fine. Just last one then. This one's quite an interesting one. If you struggle, I can help you answer it. So Kate from the Chinese Community Centre in Birmingham. So the first comment: several members received phone calls which did turn out to be from Birmingham City Council, but they were confused as they hadn't realised they were on the shielding list. The phone call came from the Environmental Services number. I know how to answer that one if you struggle. The second question was, 3 referrals to our day service have been closed because they hadn't been completed before lockdown. They had assessments, but not the financial check. Couldn't BCC have put them on hold to pick up rather than close them because they're having to start the whole process over again?
Let me take that second one first.
Yep.
If people can get in touch with yourself or myself, June,
yes,
we will try and short circuit that, because that doesn't sound very, it does not sound like a good way forward or to be doing things. So let's see if people can get in touch and get the details. Let's see if we can move that forward without to go around the whole process again.
That's fine. Okay, I've just posted my email address on the Q&A, so you should be able to get that, so you'll be able to come back to me. And I can answer the first question, Graham, for you, because my other role is within the corporate, supporting the corporate contact centre, and in fact I helped set up the emergency line for Birmingham City Council residents at the time of the start of lockdown. It was quite a busy period. The reason the call came from Environmental Services number is because we used our existing contact centre advisors to make some of these outbound calls. So it might have been that we moved an advisor and we trained them up on the new emergency phone line, but previously they'd been on Environmental Services. So as they rang somebody, it might have displayed environmental services, just like it might have displayed somebody from housing options or housing repairs. It depends where the advisors came from. These advisors were all working from home, and if I just update you that there's nearly 400 contact centre advisors for the City Council, so changing things like their display at the time wasn't our priority, unfortunately. It was more about making sure that citizens were safe. So I am sorry if that confused anybody. I'm not quite sure if we could change it any quicker in the future, but it's definitely something that we can take back and feed into the contact centre.
Yeah, and just to add to that, I mean, I think the other confusing thing, and I know this from my own family's experience, was, you know, people weren't sure if they were shielded. They, you know, because it actually kept changing. I mean, my son was on and off the shielded list on several occasions, you know, so it was that lack of clarity about whether somebody was shielded, if they were meant to be getting food. It was just really quite confusing at the start, and I can imagine, you know, people, you know, I mean, that not, as we know, not everybody would have got a text and not everybody would have answered it. Some people may have got a letter and promptly thrown it in the bin. You know, we really don't know, and I think that was part of the problem as well.
And if I can just add to that, Graham, we have had a few questions posed on that, and we did in the contact centre receive quite a few calls from people who were confused whether they were on the shielded list or not. The shielded list also required you to register. Again, that was online, and we do accept that some citizens don't have the opportunity to do that online. The letters from government were sent direct to citizens. There was confusion. We had doctors' surgeries ringing us, so there was quite a bit of confusion around who should and shouldn't have been on the shielded list and for what conditions.
Yeah. Okay.
Next slide.
Okay, move on to the next slide then. Thank you. So this next set of slides and questions we're asking about really was about how the pandemic affected people's health and well-being. Did people feel isolated? Were they able to get support from family, friends and neighbours? And was it possible to find out what local support was available? So let's look at the next slide. And this was you can see the same question, so we can move on to the next slide. Okay, so I was agreeing with the statements, and this reflects that I mean, nearly half of people felt that their health and well-being was affected by the pandemic. There's no surprises there really, and about a third felt that it wasn't. Next slide. And over half people felt isolated, just under a third didn't. And this is really interesting. Well, the good news is that, you know, neighbourhoods and communities still seem to be alive, because nearly 3/4 of people asked were able to get support from family, friends and neighbours. And that's a small number. Sorry, if we could just go back. Yeah, the 15% is a small number, but nonetheless it's a significant one. And it is of concern that you know, that many people, you know, I mean, what we're talking about is 15 people in every 100 were not able to get support. And that we need to, again, this is one of the things we need to come back to. I'm really pleased that through the efforts, not just of the City Council, but mainly through the community groups, through good neighbours and so on, the vast bulk of people are able to get support. But it's that 15% we need to make sure do get support if we go into a second wave. Next slide. And this is split pretty evenly across the piece. We, you know, people were agreeing or disagreeing with the statement. They could find out what local support was available to them. Again, it comes back to some of the things we've talked about in terms of communication, improving the communication. Clearly for some people it worked well, they were able to get the information they wanted, but for others they didn't. And we need to address that, understand how better to get the information out and make sure that we do so. Next slide. Okay, so I mean, it's as I say, there's some good news in there, and I think what is interesting, what really struck me right from the very start, the feedback I was getting was that people were stepping up, they were offering their services, they weren't waiting to find out or for someone to come and talk to contact them. They were ringing the council and saying, how can we help? What can we do? And we were able to work very closely with Birmingham Voluntary Sector Coordinating Group, BVSC, and they were able to help bring people together. We were able to use our neighbourhood network services, which is that local network of support, to reach out to people, to contact them, to engage them, and so on. So there was a lot that was going on, but clearly we can, still need to improve it. We hadn't got to where we really needed to get to. But I think overall, it does demonstrate that communities and neighbourhoods are still thriving, and people still want to support their neighbours. Any questions, June?
Yeah, we've had some questions in, and actually just following on from what you've just said, Graham, the Neighbourhood Network Scheme and Disability Resource Centre are working with the council to make local connections and support available. This is being communicated to citizens locally via leaflets. This should help citizens with details about what is around them in lockdown. So that was more of a statement than anything else. So thank you for that. And Gary's commented, so we do understand there is no blame as a provider. We all have to work outside of the box. There have been successes. We've had to learn new skills, staff, citizens, volunteers, families. Internet connections are a problem, but if we've connected more citizens and families, we have, as a provider, have increased our community and our outreach, which is positive in these difficult times when we're all working together is not all negative.
That's a really great feedback, Gary, and I'd agree entirely with that. I think, the easiest thing in the world would have been for us all to step back and point fingers and all of that. What was really good, in Birmingham was that people didn't do that. They actually did step up to the plate. They went the extra mile. As I say, the providers I was talking to earlier today, the response was absolutely brilliant. They didn't hang about, they didn't shut. They just said, what can we do and how can we do it? And I think, this exercise, and picking up those points about, earlier that we talked about commissioners not communicating and so on and so forth, we'll learn from that and we can improve that, because that's clearly something we need to do. And what's fantastic is that people were prepared to engage and do what they could, at every bit of society within Birmingham. So that's what we build on, and we learn from the things that didn't go as well.
Last question. This one's from Lisa. And I've just lost it, so please do forgive me just one moment. If there is going to be a second wave, what will happen to the data you've collected, and will people need to re-register? I'm not sure if that's a question we're able to answer or not, Graham.
No, I mean what I would hope we could do is use information we've collected, but I think we're all painfully aware about data protection and so on. We need to be very careful with that. Was one of the things we had to be very careful throughout this exercise, in terms of the law around data protection and so on and so forth. So we would need to be careful, but I would hope we wouldn't have to, if there was a second wave, go and start all over again. I would hope that we could, as I say, learn the lessons, use the information we've got so that we can be more proactive. It did feel at the beginning of all of this, we were being very reactive. Every day just started with another challenge and another challenge, and it went on like that till you would begin to sort that one, then that one, and you'd get on top of things. Then the next day, start again is what it felt like. Whereas I think there is a lot of learning. So I think if there is a second wave, we can be more proactive. We know what to step up, how to step it up, and so on and so forth. So I think we could react. I honestly believe if there is a second wave, we will react much better. And I would hope we could use that information we've got so we can get direct to people rather than, as people have talked about, trying to communicate with people who clearly, didn't have the internet or whatever. We need to learn from that and move forward. So I would hope that we could improve.
No. So question, it's an anonymous question, this one. Will building-based services for disabled people continue in Birmingham when it is safe to do so? Or are Birmingham City Council hoping to deliver the majority of services online?
No, I mean, I think we you know, a lot of us have worked mainly online over the past few months. And, you know, it's incredible what the technology can do, but we're all human beings and we all miss that face-to-face contact. So, you know, certainly from my perspective, running a social care service is very important to me, that we can begin to get people engaged again. How and where we do that may have to be different going forward. We will have to think about that very carefully. I think it's a very difficult period. There's a lot of pressure on for us to try and get things back to normal really quickly, but we have to remember that coronavirus is still out there. It is still a major threat to health, particularly for people with disabilities. The inequalities in this disease are really frightening. You know, and the figures are, you know, 11 times more deadly for people with disability. That's a very, very worrying statistic to me, and it's something we have to be very mindful of as we begin to think through how we get our services back up and running. So we need to think about that very carefully. We need to look at different ways we can do that, but from my perspective, we will be trying to bring people back together again, but we may have to think through how and where we do that going forward.
Not sure how many slides you've got left, Graham, but there is another question in. Do you have, there you go, do you have any information about the degree of support for the lesbian, gay, bisexual and trans people in the community?
Well, that's certainly something that, again, the overall experience is that groups in the community who are disadvantaged or discriminated, they face discrimination and so on, have been particularly badly affected by COVID. I mean, that's the general finding. And again, if you were looking for a theme, it's that this is really really thrown up. One is thrown up a spotlight on the inequalities that exist, and it's accentuated them. So, you know, that's a key learning exercise from us. And when I shared with staff last week in June, and others are aware of this, that we're revisiting our vision at the moment and the strategy that will support it. And one of the things that I think we need to be much more explicit about is social justice, and how we address that, and how we see our organisation as a way of you know, challenging discrimination and supporting groups in the community that do experience discrimination. So that's certainly an area that we will be looking to learn from the experience of the past few months and build upon, so we can be, you know, we can begin to do something to address the social injustice which we currently see in our society. Okay, so let's move on to the slide so we don't make sure we get through all of them. Oh, so there we go. If with another pandemic, what would you like to see happen? So this is really the last question before I hand back to Satish. And again, I mean, some people may have some ideas now. Great, send them through. But it's something you might want to reflect on. And it could be in the areas of communication, types of services, doing things more online. You know, I would really, you're the best people to advise us on that, and we really look forward to seeing what your thoughts are about what you would like to see happen going forward. We know this isn't going away anytime soon, so, you know, really let's you know, have a good think about it. Let's have an exchange of views, and let's see what we could put in place to address you know, the risk of another wave of this pandemic. Okay, so I believe at this point, if we go on to the next slide, we hand back to Satish.
Thank you, Graham, and thank you, June, for an excellent insight into the details of the data and the answering of the questions. Thank you. Next slide. Valuation. As with all forums, there needs to be a valuation and a feedback of information given to you today. So before I go into that subject matter of the evaluation, let me inform you of our next meeting. Next slide, please. as it says, Tuesday, 8th of September. I very much hope that all of you can make it again. We'll look forward to seeing there. And now regarding your feedback, could I have next slide, please? We welcome all your questions, comments, etc. via the Get Involved at birmingham.gov.uk. And one more item before I close this meeting is to thank you all for your time, and both to June and Graham for giving up their excellent time and excellent details of the new environment we will be working on now on, really. So from then on, I'd like to say thank you for everybody for participating in this forum. And last one thing is to say thank you and goodbye.
Thank you, Satish.